Hello, good morning. May I please request all of the panelists to kindly turn on their cameras as we get this webinar started. I request all the panelists, all the doctors to kindly turn on their cameras to get this webinar on understanding motherhood and postpartum care begun. So I request you all to kindly turn on your cameras. While that happens, a very good morning to everybody present here. My name is Hiba and I warmly welcome you all to today's webinar presented by Kauvery Hospitals under the Hindu Wellness Series. So with Mother's Day just round the corner, we are to shed light on a topic that truly matters, that is understanding motherhood and postpartum care. As you all must be aware, motherhood is a beautiful yet a challenging journey, and today's session is all about creating awareness, offering support, and celebrating the strength of every mother that is around us. We are super happy to have four amazing doctors from Kauvery Hospital. So I extend a warm welcome to firstly Dr. Tendral, Clinical Lead and Senior Consultant, Obstetrics and Gynecology, Kauvery Hospital's Radial Road. A warm welcome to you, ma'am. We also have Dr. Anita, Senior Consultant, Obstetrics and Gynecology, Kauvery Hospital, Alvarpet. We also have Dr. Susan Martin, Consultant OBG and IVF, Kauvery Hospital, Vadapalani. And joining us from Kauvery Hospital, Tirunelveli, we have Dr. Siraj Fatima, Consultant Obstetrics and Gynecology. So we have four Wonder Women on the panel here today. So let's get the conversations started. So our first speaker for today's session, we have Dr. Tendral here with us. With over 20 years of experience, he specializes in high-risk obstetrics, gynecological laparoscopy, and hysteroscopic procedures. She's also an alumni of Madras Medical College and Jipmar Pondicherry. She's known for her patient-centric approach, promoting minimal interventions and supporting normal deliveries. She's passionate about providing holistic care through pregnancy, childbirth, and postpartum. She's our first speaker for the day. She'll be talking to us about antenatal care. So warm welcome to you, doctor. The floor is all yours.
Good morning, everyone. Hi, Hiba. Thank you so much for the kind info. So let me start my topic, understanding motherhood. I'll be discussing here about antenatal care. Motherhood is one of the most profound and transformative journeys a woman can experience. And today we are here to see the most important part of the pregnancy journey, the antenatal part. The antenatal care, I should say, it has evolved significantly over the past decade in terms of clinical practices and also how patients engage with their own health during pregnancy. Early detection of potential complications leads to timely interventions, and this is the main objective of the antenatal care. So for us clinicians, it's like evidence-based protocols and guidelines, and also which is universally accepted and it is more reliable. And from patient point of view, patients ask questions, they make informed choices, we educate them, support them, and they also create their own birth plans. There are mobile apps which help them in tracking their blood sugar records and also the BP monitoring, and also to know their gestation age by weeks. So now it's become more of holistic care where it's not only about physical health, but also emotional well-being, the social support, and also the patient's individual preferences are taken into consideration. So the importance of antenatal care protects your health, it reduces risk, especially high-risk pregnancies, diabetes, hypertension, preeclampsia. So antenatal tests nowadays in modern obstetrics, it's not just investigations or not tests and just checkups alone. It also involves supporting emotional health, and also it slowly prepares you for labor and delivery. And there are technology advancements which helps in monitoring, better monitoring of baby growth. with ultrasound, Doppler, and other genetic tests, the prenatal tests like NIPT, etc. Many of us think antenatal care, the pregnancy care, starts after conception, but it starts much earlier. So here comes the importance of preconceptional counseling. A healthy start leads to healthy pregnancy, and optimizing health is very important before you embark on your pregnancy. So especially if you have diabetes, high blood pressure, and thyroid issues, these issues have to be sorted, brought under control before you become pregnant. Folic acid tablets will be given to you to prevent serious birth defects, and also vaccination in case rubella, chickenpox, and also HPV vaccination. And lifestyle changes, especially in cases of PCOS, obesity, and people who have fertility issues, diet and exercise and weight reduction plays a very important role. And planning timing of pregnancy, like spacing pregnancy in between your pregnancies, and also genetic counseling, especially if you already have a child with genetic disorder or a family history, you go for genetic counseling. And review of medications. If you're already on medications like for seizures or hypertensive medications, you will be reviewed, and these medications will be reviewed, and then baby friendly medications will be given to you. So this is the importance of preconceptional counseling. So coming to the trimesters of pregnancy, like 280 days of pregnancy, it's going to be 40 weeks. When you complete 40 weeks, it's the EDD, the due date, the expected date of delivery. You have 3 trimesters, and these are the stages. The first trimester, second trimester. The first 12 weeks is going to be first trimester, the second trimester up to 28, and thereafter it's the third trimester. So these are the important doubts which patients have: the diet, exercise, and all that. Your diet in pregnancy has to be very colorful. Your plate has to be colorful. It has to be full of five important components: grains, whole grains, fruits, vegetables, proteins, and dairy products. And we say a well-balanced diet is very essential for a healthy baby and healthy motherhood. Food provides nutrients to you and your baby, and the food needs are different. It depends on your weight, your pregnancy, pre-pregnancy weight, your height, and also the physical activity levels. And the food should be adequate enough for the growth of the baby, and it should not lead to excess weight gain in the mother. Certain foods which you have to avoid are like undercooked meat, and also alcohol, caffeine excess, and also certain types of cooked fish because of high mercury levels. So coming to the medications which you can take during pregnancy and which you should avoid, which are safe and which are unsafe, we have something called the FDA category of drugs, which is like A to X. And here, most of the medications like supplements, the folic acid supplements, and the vitamins which we give belong to the category A, and most antibiotics belong to category B, C. And X is something which you should avoid during pregnancy, for example, methotrexate, isotretinoin, etc. So these medications, so any kind of medications, discuss with your doctor before having the medications. So exercise plays a very important part, and how it leads to benefits. It boosts your energy levels, it leads to better sleep, it reduces backaches, and also decreases your risk of gestational diabetes. It prepares you for labor and also fastens your postpartum recovery. It can be anything. It can be brisk walking or prenatal yoga, cycling, and low impact aerobics and swimming. So anything for about 30 minutes a day for most of the days in a week will be very beneficial. Sleeping position, avoid lying on the back after 28 weeks for better blood flow to the baby, and also to avoid harms to the baby in the second and the third trimester. Usually travel during pregnancy, it's usually safe, and for most mothers and for most pregnancies. And the best time to travel, we can say it's in the second trimester, around 14 to 28 weeks is so safer and most comfortable, because that's the time when your nausea and the morning sickness would have come down, and you'll feel more comfortable at that time. and also there is a decreased chance of miscarriage during that period. You always discuss with your doctor before travel and what precautions you need to do. And also, you carry your prenatal records if you're traveling long, and stay hydrated always during travel. Take breaks in between 1 to 2 hours. Every 1 to 2 hours, take a walk and then use restroom, and also drink plenty of fluids. And also wear seat belts, like it has to be low across the hips and not across the belly. So who all needs to avoid travel? People who have low-lying placenta, who have preeclampsia, which is very high blood pressure, and also preterm labor risk is there. And also, if you have uncontrolled medical conditions, we usually advise you against travel. So when this is one thing which people commonly ask, like how to get ready to the hospital and when to come to the hospital, and these will be the symptoms when you have to get ready and come to the hospital: when there is bleeding per vagina, when your waters break or you have decreased movements, and the frequency of movements is not as before, and there is pains and which is increasing in intensity and frequency, headache and disturbance of vision. So all these you have to come to the hospital. Always from 32 or 34 weeks onwards, slowly get your bag ready with all the things which you require for your baby and for yourself. And also you can even have a music playlist so that it will be soothing for you during labor, and also it will help in the coping of pain during labor. And if you have a birth plan with you, you can carry it along with you, and also use comfortable clothes and keep yourself hydrated towards the end last few weeks of pregnancy. So I will not be completing if I don't touch upon this emotional journey, which is the pregnancy itself is not just giving birth, and it is actually an emotional journey. And this is mainly because, okay, if there are mood swings during pregnancy, you may be angry, you may sometimes feel irritable, you may have anxiety, depression, and mixed emotions. All these are normal during pregnancy, and these are mainly because of the hormonal changes. So practice self-kindness. You accept that it is very normal to experience these feelings, and also these are mainly because of the body changes, the discomfort you undergo, the transition, and because it's a big transition which is happening, a new experience, a completely different phase of life you're going to enter into, and sometimes because of the past experiences which may stir up these kind of mixed emotions. So in this case, how are you going to cope up? You discuss with your friends, your partner, and also we are there to support you, and also do meditation. Rest and sleep will definitely help you. Sometimes prenatal class and support groups will be of great help. Practice self-kindness and hobbies, and some also like to have a trip, which also helps in a great way. So the take-home messages here are: best pregnancy care starts before conception. Antenatal care has become more comprehensive nowadays. It's patient-centered and technology-supported system. A well-balanced, nutritious diet is important for a healthy mother and a healthy baby. Staying active during pregnancy is good for a healthy pregnancy. Also, see to that you stay safe and avoid risky activities. In most cases, travel is safe, second trimester being the safest, and follow the precautions. Pregnancy is a time of big changes. It's normal to have ups and downs, but it's also important to know when to seek support. Modern antenatal care is here to support all parts of your beautiful journey. Thank you so much for the opportunity. I would also like to thank the Hindu team for thoughtful selection of this very relevant topic, which is the need of the hour. Thank you so much.
Thank you very much, Dr. Tandil, for giving this webinar a super duper start. Great start. I must say thank you very much once again. A question, I think to the audience, in case any of you have any questions, you can put the questions up in the Q&A box, and towards the end, you will have all of our doctors answer them for you. So let's make use of this chance to put up all of our queries, and we have our four expert doctors who will answer this for us. Let's move on to our next speaker. Tends to talk to us about intrapartum care. We have Dr. Siraj Fatima here with us. She's an excellent obstetrician, gynecologist, and laparoscopic surgeon with a strong focus on high-risk obstetrics and advanced laparoscopy. She holds an MBBS, DGO, DNB, and a fellowship in endogynecology. With extensive experience in handling complex deliveries and laparoscopic procedures, she is known for her clinical precision and patient-centric approach. So over to you, doctor. The floor is all yours.
Kind introduction. Very advanced happy Mother's Day wishes to all the mothers over there. So I'll share this. Today my topic is intrapartum care. As my previous speaker, Ma'am Dr. Thendal, told about the different stages of pregnancy. Having gone through the different stages of pregnancy, the woman ends up in the process of labor. So labor is the hard work to deliver the baby. It's for the normal delivery. So I'm here to give about brief snapshot of the things you should know about during the process of labor. What are the things that are going to happen to you in the labor room or in case of normal delivery, and the theaters, operation theaters in case of cesarean section. So madam has already told the warning signs about the labor process, labor signs and symptoms to which the patient has to come into the hospital. So the different modes of delivery or vaginal. The vaginal delivery could be spontaneous, where the patient gets pains on her own, or induced. Induced is the we doctors induce the labor pains for patients with high risks like pregnancy, diabetes, or hypertension, or the breaks, pain like that. Instrumental delivery. So when the normal, when the mother is not able to push the baby for so long, or the fetal heart rate is it is on the lowest side, or there is some changes in the CTG monitoring. We do CTG monitoring during the process of labor. Any changes in that, to cut short the duration of the labor time, we use forceps or a vacuum. So cesarean section could be emergency or elective. During the process of labor, any emergency comes, we take it immediately. That's called emergency cesarean section. Or it could be elective, which is planned beforehand when the patient has previous surgeries or any high-risk factors. So we have WHO Labor Care Guide, which is given by the World Health Organization for the doctors, but also for the birthing women to know about their rights and the process of labor. So these are the things I'm going to cover about the birth companion, pain relief, place and mode of delivery, packing your bag, the stages and duration of labor, and what do you expect in each stage, and position and diet in labor, and fetal heart monitoring. So first of all is the birth companion. These first three things like the birth companion, pain relief, place and mode of delivery should be discussed beforehand with your obstetrician before the patient enters into the labor. That is in the third trimester. It is better to speak about the things with your doctor. Okay, birth companion. It could be your husband or mother. It relieves the anxiety of the parturient or labor mother, and it be comforting for her. And pain relief. There are different options for pain relief in labor. The main thing being a labor epidural, where the anesthetist will give injection in your back, and the sensations will be there, but of every woman, and every woman not suffer that is in the labor. So it is a right to ask about the labor epidural, and it's very useful for both the doctors and the patient. And there will be excellent cervical dilatation we notice with the epidural. So for all the others offer labor epidural. And lastly, this is a nitrous oxide gas which is used during the second stage where the pain is intense. We give only during the contractions with a mask. And we have opioid analgesics like pethidine, which we use during the labor. So place of delivery, it should be discussed, as I told, it should be discussed beforehand. You should bring all the records during the admission. That is very important thing. So as madam told, packing your bag, these are the things we need to have importantly for the mother, dresses and underpads and the creams and all. And for the baby, you need to take blankets and diapers and all the things. For the dad also it is there. And here we go about the stages and duration of labor. There are 4 stages of labor. First stage is the onset of the labor pain and till the active, when the cervix dilates till the full dilatation, that is 10 centimeters. And the second stage is the full dilatation to the delivery of the baby. And the third stage is the delivery of the placenta. And fourth stage is the following 2 hours after delivery, where we monitor the patient for any excessive bleeding. So you can see the baby and this pelvic bone and the uterus, and down is in the first picture the mouth is closed, uterus mouth is closed. From it's about 4 centimeter in length, and during full dilatation in the second picture you can see the mouth is fully open and the baby enters into the bone. So this is the first stage of labor. So the first stage has latent phase and active phase. Latent phase, it lasts about 12 hours to 14 hours in primigravida. In multigravida, it is less shorter. Sorry. So latent phase starts with the true labor pain to 5 centimeter dilatation of the cervix. The main actions are the dilatation and effacement. What are the signs? The patient may be getting regular contractions in 15 minutes or 30 minutes, and there should be bloody discharge from the vagina, and the water may break. These are the signs of the latent phase of labor. So we should identify difference between the true labor pains and the false labor pains. The true labor pains increases, the duration of the pain increases, the frequency from 30 minutes to 15 minutes. The frequency increases, and the duration of the labor pain from 10 to 20 seconds to each pain lasts longer. So these are the signs of true labor pains. False labor pains doesn't increase in intensity or duration. It relieves with the pain medications. So as I said earlier, the first stage, latent phase may start from 20 hours. Average duration for women is 12 hours, maximum up to 20 hours. And the multigravida, it is 14 hours, maximum average is 8 hours, maximum up to 14 hours. So next is the active phase. It starts from 6 centimeter to the full opening of the mouth, that is the 10 centimeter. So it lasts each hour 1 centimeter dilates in primigravida, 1.5 centimeter dilatation in multigravida. So the active phase of the first stage of labor lasts around 4 to 5 hours in primigravida, 2 to 3 hours in multigravida. So second stage, as I told, after the full opening of the mouth, the fetus head has to come through the bone to the perineum or the vagina. So it takes upper limit of normal is 3 hours. 3 hours. Average is 1 hour. Maximum is 3 hours. So for the second time or third time mothers, the upper limit is 1 to 2 hours. Average is 30 minutes. So in case epidural anesthesia is there, the limits may be prolonged. So what are the positions and diet in labor? The first stage of the labor, in latent phase, the mother can take whichever position is comfortable for her. She can stand, walk, squat, or she can lie in the left hand position. She has to take a lot of liquids, and she can take soft diet like bread, idlis and all. The fetal heart rate will be monitored every 1 or 2 hours in the latent phase, and she has to pee regularly so that the head descends down. The second stage, she needs frequent checking of the fetal heart rate. If for the acceleration of the labor, if any drip is, we'll put IV line and drips. In that case, the mother can lie in the left position and continuous monitoring of the heart rate will be done. So what is the second stage? So it is the pushing down or the bearing down stage. The fortunate mother should know how to push. It will be taught by the midwives or the doctors beforehand. They have to take deep breaths in each contractions. They have to concentrate on bearing down, and they have to learn how to bear down. This leads to a smooth delivery of the baby. So third stage of labor, it begins with the delivery of the fetus to the delivery of the placenta. It will take our average duration is 15 minutes, maximum is 30 minutes. If the placenta is not separated after 30 minutes, we have to remove under sedation. So it can cause excessive bleeding. So this stage should be monitored carefully. And it's a happy birthday to your little girl. So this is how your child is born. So the previous one are all for the spontaneous pains. So how we will induce pain? What are the methods we use? We use the cerviprime gel, or we put a tube called a Foley's catheter for opening the mouth of the uterus, and we can use the intravenous drip to increase the pains, and we use misoprostol tablets to induce pains. And the other mode of delivery is the cesarean section. It could be emergency or elective, as I told before. In case of emergency cesarean section, if the patient is having epidural, she can be taken up in the same epidural. We can take her up for emergency cesarean section. If it is elective cesarean section, you need to know about the nil by mouth. They'll keep you nil by mouth for 4 to 5 hours before. They'll give enema. They put a urinary catheter, and you have to be aware of the anesthesia. It could be regional, where they put a needle at your back, or full general anesthesia according to your condition. So complications can happen to anyone. It's unexpected. So delivery is a very delicate thing, and any little complication should be identified earlier. And so we are here to save you. So happy motherhood and happy parenting. The natural state of motherhood is unselfishness. When you become a mother, you're no longer the center of your own universe. You relinquish that position to your children. Thank you for the opportunity.
Thank you very much. Thank you very much, Doctor, for giving us that amazing presentation. Again, a reminder, in case any of you have any questions for the doctors, you can put them up in the Q&A box. And towards the end, we will have all of our doctors answer these questions for you. So with that being said, let's move on to our next speaker. She'll be talking to us about postpartum care. We have Dr. Anita here with us. She's a gold medalist with over 15 years of experience in women's health, a highly skilled robotic surgeon. She specializes in minimally invasive and advanced hysteroscopic surgeries. Her core expertise lies in gynecologic oncology with a strong focus on cancer screening, early detection, and timely treatment. She is committed to providing precise, patient-centered care through the latest surgical technologies. Like I'd mentioned, she'll be talking to us about postpartum care. So over to you, Doctor. The floor is all yours.
A very warm welcome to everyone for this webinar, and I thank the Hindu team for giving me this opportunity. I'm Dr. Anita, consultant gynecologist, Kauvery Hospital. Today my topic will be after the antenatal, intrapartum. It is the postpartum period and postpartum care. So when you hear the term postpartum, it is the period after delivery up to 6 weeks. That is, postpartum or the puerperium is the period after delivery till 6 weeks. Now, the immediate postpartum period is 48 hours after delivery. This 48 hours is very important because this time a lot of changes happen in the women's body after delivery. We term it as the physiological changes, which happens after delivery. Now, after delivering, the patient's uterus will gradually decrease in size. We term it as involution. So, the uterus involutes gradually over a period of 6 weeks, and there will be initiation of lactation after childbirth. So, regarding the breastfeeding, initiation of lactation is nothing but when you deliver the baby, whether it is by a spontaneous vaginal delivery or a cesarean section, the breastfeeding can be initiated immediately after delivery. So that is very, very significant because that will enhance the milk let down reflex and encourages the suckling reflex from the infant. So the mother's initial lactation feed, which is rich in proteins, it is called colostrum. It is very important for the baby's health. And after lactation, in the postpartum period, it is also about the healing of the mother. For example, in vaginal delivery, if an episiotomy stitches are given to facilitate vaginal birth of the baby's head, the wound healing happens. And even after C-section, when the mother is being shifted to the postoperative period, the wound care and the instructions according to the diet and what is to be done in the postpartum period will be guided by your doctor. And the postpartum period is the time where you're going to bond with your newborn baby. So that bonding happens when you start the lactation, and also the baby is with you and you understand the baby's needs and how it is done. The team, I mean the doctor and the nurses team will help you how to feed the baby, how to take care of it, so that when you're discharged from the hospital in the postpartum period, you're well prepared to take care of the baby. So, as I said previously, postpartum period is a very important period after delivery, and it is also called puerperium. So, once you are discharged from the hospital, that is, in case after a normal vaginal delivery or a C section, it is usually done after 48 hours after delivery. You have to concentrate on what diet you have to take in the postpartum period to enhance healing of your body, and as well as nourishing your body for recovery, and also you prepare yourself for breastfeeding. So, what is the diet which is recommended in the postpartum period? So, when it comes to diet, even in the antenatal period, there are recommended dietary allowances which is required for the recovery of the mother and also for breastfeeding. Take food which is rich in lots of fruits and vegetables, whole grains and proteins, and the required recommended dietary requirement of calcium is 1000 milligram after delivery. So you have to continue your iron and calcium supplements which you have been taken in the antenatal period, even in the postpartum period. It should be continued till you breastfeed the baby for the next 6 months. So when you breastfeed the baby for the first 6 months, it is called exclusive breastfeeding, because you are going to give the baby only breast milk. You're not giving the baby any kind of, like even water. So that is termed as exclusive breastfeeding. So when you do exclusive breastfeeding, your secretion will be enhanced by the suckling of the newborn. So initially there will be colostrum and then there will be adequate milk secretion. So regarding the diet, you have to always stay well hydrated. Hydration is a very, very important concept for adequate milk production. And your diet should be a very well balanced diet which includes protein and healthy fats too, along with your iron and calcium supplements. So, coming to the contraception in the postpartum period. Now, many women aren't even aware, or they hardly discuss about the choices of contraception, which has to be done in the early antenatal period itself, so that the mother is prepared for the choices of contraceptions during delivery itself and after delivery in the postpartum period. So, when the counseling should be done for contraception? So, when a mother gets pregnant for the first time or she is delivering for the second time, a comprehensive counseling about the choices of contraception should be advised to the mother. So when it comes to comprehensive counseling, it starts even in the antenatal period. So the acceptance of the mother for contraception is best in the intrapartum and the postpartum period. And the mother should be always given informed decisions about the choices of contraception. Because when you talk about contraception, patient can't take decisions unless they are informed about the choices, and they are also able to choose what will suit their lifestyle. So that's called informed decisions. And in India, we have an entity called unmet need for contraception, which is nothing but many couples will need contraception, but they won't, come ahead and talk to the doctor to choose what method of contraception they want. Now, this is called when a couple needs contraception, but they are not aware what to choose and how to go about it. It is called unmet need for contraception. And surprisingly, the unmet need for contraception among women in the first year postpartum is quite high. That is, it is around 65 percentage in the first year postpartum. But this is the ideal time. You have to talk with your consultant to choose the kind of contraception which suits you after a first delivery or even after delivering your second child. Now, coming to the contraceptive options, we have intrauterine devices, pills, and permanent methods if you have completed the family. So, when it comes to intrauterine devices, they are nothing but small devices which will fit into the uterine cavity. It is done by your consultant. They are long acting reversible contraceptives because they act for quite a long time, say around 3 years to 5 years. You can choose what kind of IUD you want, and then when the copper T or the IUD is removed, there is reversal of fertility. So when talking in terms of fertility, you might wonder, when a woman delivers a child, when the fertility returns. So it depends on the mother how she breastfeeds the baby. In women who do exclusive breastfeeding, the fertility can be delayed because there is a term called lactational amenorrhea. Because when you feed the baby, you won't get your periods. So that will act as a protection and a contraception also. But when a mother does breastfeeding partially or does not do an exclusive breastfeeding, the fertility even returns within a month after delivery. So you should always discuss with your consultant and tell what kind of contraception suits you better so that you can choose a method which suits you. There are also options of PPIUCD, which are nothing but postpartum intrauterine contraceptive device, which can be inserted immediately after a normal vaginal delivery or during the time of cesarean section, which can be left in place till the mother plans the next pregnancy. So the PPIUCD can be done post placentally immediately after delivery or within 48 hours after delivery. Now, why we talk about IUDs so much? Because they don't affect the quality of the breast milk, and also they are very comfortable, and they provides healthy timing and spacing of pregnancy. But when it comes to the choice of pills or other methods of contraception, you should always discuss with your consultant, because combined contraceptive pills or any estrogen containing pills will affect the quality of breastfeeding. Now, as I said, pills and permanent methods. So, when I said reversible contraceptives, IUDs, and pills, they are all reversible methods, whereas there is an entity called permanent method of family planning also. Now, contraceptive pills or reversible methods, you should always consult with your doctor regarding breastfeeding and the choice of oral contraceptives. Progesterone only pills, they are termed as mini pills. They are preferred than combined contraceptive pills in breastfeeding mothers. And there are also injectable contraceptives which can be considered after 6 weeks of delivery. Now, coming to the permanent methods, now this is chosen in a women who have completed family and they are not planning future pregnancy. So now this kind of family planning procedure can be termed as postpartum tubal ligation or a laparoscopic tubal sterilization. So when it comes to postpartum tubal ligation, we can do it concurrently. That is, during the time of cesarean section for the second baby or the third baby, you can plan a tubal ligation in which the fallopian tubes are occluded with fallope rings or clips or by cauterization. This is a permanent method of female family planning method, or it can be done even within 7 days after normal delivery. There is an entity called interval sterilization where you can opt for a permanent method of family planning after 6 weeks of delivery. We don't do a laparoscopic procedure before 6 weeks of delivery. Now we have concentrated about our diet, initiation of breastfeeding, and the contraceptive methods. We have to now address a very important issue which dwells on the emotional well-being of the mother. So, as previously said, now we are more progressing towards holistic care of the mother, where we are not concentrating only on the antepartum, intrapartum, and suddenly after delivery, the focus always goes to the newborn, and we have to always address the void which the mother feels, when she is overwhelmed of taking care of a baby. Now comes the entity called postpartum blues and postpartum depression. Now, why postpartum blues, where women experience mood swings or excessive tiredness and other things in the postpartum period after delivery? This is because the hormonal support which was there throughout the pregnancy and the hormones levels suddenly drop after delivery. So now that causes these mood swings and fatigability, tiredness, and everything that usually reflects as postpartum blues. Now this postpartum blues is a very benign thing which it usually occurs 2 to 3 days after delivery, and it settles within a span of 2 weeks without any treatment. Just you have to emotionally support the mother, and she is having a good support system for taking care of the newborn. The postpartum blues will settle. As previously said, you have to concentrate on things which make you good music or good recovery. Like we say, which women are at high risk to develop postpartum blues is that any women who had some antenatal complications like high risk pregnancies like IVF conception, twin gestation, or you who has medical disorders during pregnancy like hypertension or diabetes, or if they have any intrapartum complications. Now these patients are at more risk to develop postpartum blues. So these mothers should be identified as at-risk mothers, and the counseling should be started immediately after delivery, supporting them that this is going to be only transitory and you can overcome this situation. Now, when these postpartum blues symptoms doesn't settle in a period of 2 weeks, she's going to have severe anxiety or panic attacks, or she's feeling any recurrent thoughts of even death or suicide, or she's having thoughts of harming herself or the baby. Because when you have a thought of death or suicide, it is an emergency to attend. It is similar to a heart attack or myocardial infarction. So whenever a mother says that she has a thought of suicide, it has to be addressed as an emergency. Now that is a very important symptom of postpartum depression. There are many medications which is given for postpartum depression, which will improve the mother's well-being, because only emotional support and other reassurance, it's not going to cure your postpartum depression. She might need some medications, and there are many medications to reduce postpartum depression, and it is also safe while breastfeeding the newborn. So please address your symptoms. If the following symptoms are there, that is, your symptoms are getting worse and it is hard for you to take care of your baby, and it is even hard to complete your everyday tasks and include thoughts of harming yourself or your baby, you have to get back to your consultant so that she can help you out. Now, again, be aware about the symptoms, and you have to know what is the difference between baby blues, postpartum depression, and in severe cases, we have an entity called postpartum psychosis, which can extend to weeks or months if untreated. And this is kind of, you have to treat the mother with medications so that she can enjoy the period of postpartum period and go through the period very well. So, as I said, A postpartum period is a wonderful period, which is a chance for you to bond with the baby. It's about your recovering of yourself and your health, and also taking care of the baby. So this is such a wonderful period, which they say, the kids, they grow up very fast, and to raise a kid, you need a tribe to raise the kid. It's not only the mother, you need the support system to raise the kid. But anyway, most mothers are instinctive philosophers. They know what is best for them and the baby. With this presentation, I'm just wishing a happy motherhood to all the women in this webinar. And thank you, Hindu team, for giving me this opportunity.
Thank you very much, Dr. Anita, for that super presentation. I think it covered all the important points and super duper knowledgeable. So thank you very much for sharing your thoughts on that. To our audience, in case you have any questions about the topic, please do use this chance to put them up in the Q&A box, because after the next presentation, we will have all of your queries answered. So make use of this time and let's have all of your queries answered. And lastly, for our final presentation on breastfeeding, we have Dr. Susan Martin here with us, who will be talking to us. So she holds an MS and DNB in obstetrics and gynecology, along with a fellowship in reproductive medicine. Her key areas of expertise include high-risk obstetrics, reproductive medicine, and minimal access surgery. She's known for her patient-focused approach and commitment to helping other women through every phase of their health journey, from fertility care to safe and high-risk deliveries. So over to you, ma'am. The floor is all yours.
Thank you, Hiba, for that wonderful introduction. Right. So first of all, I'd like to wish everybody advanced Happy Mother's Day before we proceed. So as you know, becoming a mother is a variable experience. It fluctuates in its joys and challenges, that is before, during, and after delivery. Each of these phases being of equal importance, but breastfeeding period is a key to a mother's well-being, her adaptation to changes, and the formation of a positive relationship with her baby. So these are some of the topics that we will be discussing regarding breastfeeding today. What exactly is breast milk? Breast milk, as you know, it is produced by the mammary gland. It goes and contains all the required proteins, sugars, and fats, as well as the vitamins and minerals that is required. The breast as such is made up of a large amount of adipose. That means fat cells that are there. Along with that, we have these balloon-shaped lobules which are there, which contain alveoli and myoepithelial cells, which form the fundamental secretory unit of the breast. We also have got the ducts as well as the lactiferous sinuses which are there. Now, the main thing is, how is it that milk is reaching our breast? That is, how is the milk let down? It's called as the let down or the milk ejection reflex. When a baby sucks, it goes and triggers certain sensory impulses within the areola. This sends an impulse to the brain, which goes and releases the oxytocin. Oxytocin causes the myoepithelial cells. Finally, and they get discharged due to the nipple. Now, at called as the positive feedback. How does the infant know that, or how do you know that there is adequate amount of letdown happening? The infant begins to suck actively. Milk may even drip from the opposite side. The mother may feel tingling or a full sensation in her breast, along with some amount of uterine cramping, which may be there. You might be wondering now, I'm producing adequate milk. Is my baby getting enough of water in it? Yes, breast milk, which is available with exact amount of free water that is required. It has got proteins, fats, carbohydrates, vitamins, and minerals also. Along with this nutritional components, there are certain non-nutritional components like your antimicrobial factors. These help to fight against infection as well as some immune-mediated diseases for which we have got secretory IgA. As you can see, breast milk contains everything that is required, maybe a little deficient in vitamin D and vitamin K, which can be supplemented from elsewhere. Now, this question perplexed a lot of people. What are the types of breast milk which are there? As you can see, breast milk can range from being colostrum, which is the initial yellowish orange milk, followed to transitional milk as well as mature milk. Colostrum is otherwise called as liquid gold. Why? Because it contains a large number of immunizing factors and it is produced during the first 1 to 7 days of birth. The transitional milk, as its name suggests, is a transition from colostrum to the mature milk. Mature milk starts getting produced about 2 weeks later. That means the initial part of the milk might look a little bit clear or bluish. This is because of the high water content and it's called as fore milk. Next milk that comes as you keep pumping or towards the evening, what you will see is called as hind milk. It will be a thick yellowish kind of milk which has got a high level of fat, and that is your hind milk. So like all the previous speakers, like Anita ma'am and Thendral ma'am suggested, when would you start breastfeeding a baby? It has to be done right after birth, within 30 minutes or within half an hour, or as early as possible, be it a normal delivery or even a cesarean section. Now, what are the stages that is lactation? In a newborn, you might have multiple feeds that are happening. So you might be even feeding up to 12 times in 24 hours. By the time the baby is about a month or so, the duration becomes longer and there will be less number of feeds that are there. And by 6 months, the baby requires only 3 to 5 times of feed of breast milk. Now comes, how do you know that the baby is latching on correctly? So these are the 4 steps that are there. So first of all, once the baby is awake and crying, you can always even help to stimulate the baby. For that, you have to hold the baby's mouth closed and touch the nipple. So the step 1 says, hold your breast in a C-shaped or in a U-shape, like as if you're holding a sandwich. Bring the baby towards the breast, where one finger will be at the level of the ear and the other third finger will be at the level of the next ear. Tilt your baby's head a little bit so that the chin is the one that will touch the baby's, just the mother's breast first. Help to latch down by squeezing or by clasping the breast into the baby's mouth. How do I know the fact that proper latching on has happened? 1, the baby themselves will open their mouth wider, the chin will touch the breast, the lips will get flanged out, and you can even hear the sucking sound, and you might be able to see swallowing. How do I now dislodge, or after how long do I stop breastfeeding? It can be even up to 20 to 30 minutes that are required, sometimes longer depending upon your baby. You can even dislodge the baby by just using your little fingers to open the baby's mouth. Following that, if you look at your nipple, you'll see that it looks long and rounded. That is showing a sign that you have fed well. Now, how do I feed? Which position would I choose if I wanted to feed my baby? You are allowed to choose any position that is comfortable as long as there is adequate amount of support to your neck, your back, and to your knees. You can use something called as the cradle position, which you might be comfortable with, a cross cradle position, a sideline, but remember, sideline sometimes does cause a little bit of a ear infection for babies, and preferably you should be fully wide awake when you are going ahead with a sideline. You can do the football hold or even the saddle hold. All these positions will vary according to the age of the baby. How do I know that my baby is getting enough milk? You will see that the baby is content about 1 to 2 hours after feed. They will keep on passing dilute urine of around 5 to 6 times. They will regain their birth weight. They will sleep very comfortably, and they would have passed even bright yellow watery stools which are there. So there are 10 steps that are required for a successful feeding. This should start right from the time in the antenatal period, where the mother should always be informed about the benefits of feeding. You should have a good written breastfeeding policy within the hospital. All staff should be trained for this purpose. And as ma'am said, you should initiate breastfeeding either immediately or within half an hour or to an hour of birth, or if any complications, as early as possible. You should have only exclusive breastfeeding. That is only breast milk for the first 6 months of life, no extra milk to be given. Rooming in is another method where the mother and the baby spend about 24 hours together with breastfeeding on demand, no pacifiers to give. And once the baby is discharged along with the mother, have an adequate support group. The support group does not mean that you just have to have a WhatsApp group that can, the support system even comes from within the family. Advantage of breastfeeding not only go for the baby, it also goes ahead for the mother. So what are the things for a baby? It can go and prevent a ear infection, multiple infections like asthma, meningitis, type 1 diabetes. It goes and promotes a bond which is there between the mother and the baby. For the mother, it prevents osteoporosis, ovarian cancers, as well as breast cancer, which is there. Everybody comes back asking, Paal patala kammiya irukku. What can I do? First of all, the mother should be able to eat and drink sufficient quantities so as to satisfy her thirst. That means you will increase the amount of protein that is there and decrease the calories. But please make sure you don't have to eat extra just so that you are getting milk. Drinking about 2 to 3 liters of milk is not necessary to go and increase your milk production. And unlimited breastfeeding is more than helpful in these cases. There are cultural differences as to how it proceeds depending upon each state, depending upon each community. Adequate hydration, a support system like I mentioned again, pumping the milk, natural breastfeeding galactagogues, which are there in the variety of food that is available. And sometimes, even after all these requirements, you might require a little help from your doctor who can provide you with certain lactational enhancers or medications, such as domperidone. Now, everybody keeps talking that an ideal mother should be somebody who is breastfeeding. Though there is a community, there are sides of people who don't get enough milk, who have certain contraindications as to why they can't feed, or you are planning to go back to work and you are worried as to what will happen. Will my breast milk secretion decrease? What if I only want to feed my baby? What can I do? Do I have any other options for this? Yes, you do have options for this purpose. The first thing that you can do is, if you are a person who has adequate milk secretion that is there, you can always hand express the breast milk and keep it in a sterilized container, such that with proper storage. If you find it difficult that you are not able to hand pump, then there are breast pumps which are available, which are either the manual breast pumps or the electronic breast pumps, your choosing as to which one you are comfortable with. Now that you have pumped, after thinking about it, after proceeding, what is the correct method of storage? If you're going to store milk which is freshly pumped or expressed and keep it on a countertop, or that means in a sterile room, use it within 4 hours. If you're going to keep it in the fridge, that means in the lower half of the fridge, you can keep it up to 4 days. But if you're using it in a freezer, you can keep it from 6 months to 12 months, which can be acceptable. What happens to milk now once you have taken it out of a freezer? How fast should I use it? If it is used, you should use it preferably between 2 hours to 24 hours, making sure that you never refreeze the milk that you've taken out. So how do I proceed? Once I have pumped the milk, I will go and store it in an insulated cooler bag which has got packs which are available. Even if you look on Amazon, you will find a wide variety of breast milk pumps that are available, breast milk packs that are available. Always write the date at which you are expressing it. Why do we ask you to store it in the back of the freezer is so that there is no fluctuation in the temperature. Storing it on the door as we keep reopening and closing, there will be a change. Hence, store it in the back of the freezer. Use it, as I said, either within 4 hours or within 6 to 12 months. Now, should I thaw my breast milk? How long can I thaw it for? When should I use it? You can always thaw it overnight within the fridge, or you can keep it under lukewarm water, or just in a container which has got a lukewarm water. Never refreeze back this thawed milk. Now, my baby has to be fed. How do I proceed with that? Should I go and proceed by heating it up? You don't have to heat up the milk. If you would like, you can always serve it cool or at room temperature by just keeping it even in warm water. Never put the milk into a microwave or onto a stove top. Always swirl the milk so that the fat which has separated can get mixed along with it, and always put it onto your hand or your wrist to check the temperature before you start feeding. How do you go and clean your breast pump? Your breast pump, when you clean it in a bowl or a clean basin which has got soap and water. Don't directly wash it into the sink because we will be using it for multiple other reasons. Once you have finished it, you can always buy a sanitizer which is available in the market, or you can just take a bowl of water, put it on the stove and heat it for about 30 to 20 minutes. Now comes the main $1,000,000 question. I don't have milk. I have tried everything. I have drank about 3 liters of water. My gynecologist has given me all the medications that are available. I have tried Ayurveda. I've tried homeopathy. I am still not getting milk. Am I the ideal mother that the influencers portray, or the Pinterest mother that everyone wants to become, but I'm not able to? And I still want to get back to work and I'm not getting enough milk. Am I going to be judged for going and giving formula feed for my baby? No. Thing is, if you have certain reasons as to why you cannot feed or you are not getting enough milk, you can always opt for a formula feed. The formula feeds that we get are either a cow-based formula feed. It has got almost everything similar to what is available in breast milk, though there are changes which are there, and it is not 100% that complete like your breast milk. But if the situation so demands, yes, you can use a cow-based formula milk. Soy-based formula milk is very little difficult to get, and this is usually for a person who might be a lactose intolerant baby. What are the advantages now of using your formula milk is? It's easy. You can always hand off your baby to somebody else who can make the formula. But keep in mind, even formula has to be prepared in a clean, sterile environment, along with the instructions which are given on each packet. But what are the difficulties with it? It's expensive. Every month you might be buying about 2 to 3 packets, which each packet costing around between 300 to 600 rupees, which is a little difficult for certain people. Also, it's not 100% replacement for breast milk. So what can I do? I don't have the ability to buy so many packets of breast milk of formula. What can I do? If so, I have an option which is called as a milk bank. Not many people are familiar with the fact of a milk bank. The milk bank, you have an advantage that you get breast milk, which is being given to you by another mother who had adequate supply. So please do talk to your gynecologist regarding a milk bank so that you can try it out if you are willing. Though, yes, there are cultural issues which might happen. So please do think it over, which is an option which can happen. Well, so as I said, breast milk, formula, milk bank, it is your choosing as to what you would like to proceed with, depending upon the situation in which you are. And don't ideally start branding yourself as not an ideal mother, because it is very important to get the proper support system. Now, when should I see the doctor? Anytime you have a latching issue, you do have got too much milk secretion, which can cause either a breast abscess, severe breast engorgement, fever, or you can have mastitis. Any of these issues, please do come and see your doctor. So thank you so much. As I said, it takes a village not only to raise a baby, but also a mother. And for that purpose, you have got the proper support system, which comes from the house. And also some of the tips that you can use always is feed frequently, have skin to skin contact, ensure there is proper latching, proper nutrition, hydration, and if all fails, always use a lactational consultant to help you. Thank you.
Thank you very much, Doctor, for sharing your thoughts on this wonderful topic. With that being said, we'll now take maybe 2 or 3 questions and then call this webinar a day. So I request all the doctors to kindly turn on their cameras. We have about 5 questions on the chat box that we can share our thoughts on. So let's see how it goes. Our first question says, can we air travel or travel to a hill station during our second trimester? So any thoughts on that?
So yes, I think most of the times it's safe for air travel. So usual airline restrictions is up to after 36 weeks. Most airlines restrict after 36 weeks of pregnancy. Until then, it is okay. But there are certain precautions that you should follow, as I already told you. And if there are contraindications, yes, you cannot travel, like I mentioned in my slides. And so it's better you take a aisle seat so that for it allows free movement, and walk in between every 1 hour. You can take a walk and do some stretches and hydrate yourself well. And long haul air travel, more than 4 hours, it usually leads to blood clots, as pregnancy itself can increase the risk. So in that case, you can use some compression stockings as well.
Thank you very much, doctor, for sharing your thoughts on that. We move on to our next question. It goes, can you kindly share insights regarding VBAC? I'm a 34-year-old expecting mother in my 28th week right now, and this is my second delivery. My first baby is 6 years old, delivered via C-section. So any thoughts on that is the question. Maybe all of us can share a point each and help the person answer. Yes, Dr. Siraj.
Yeah. So what is VBAC? As it is vaginal birth after cesarean section. So if there are some criteria to be met for the VBAC, vaginal birth after cesarean section. The inter-pregnancy interval should be 18 months between the first baby and the second baby. More than that, we can try. And the indication for the first cesarean delivery should be noted. If it is a recurrent indication or non-recurrent indication. Recurrent indication in the sense if the mother's pelvis bone is very narrow, so for that contracted pelvis we say, in that case it is difficult in the second time also. So if it is done for any breach or fetal distress like other conditions, we can try VBAC. But vaginal birth after cesarean section should be done in a tertiary care center where 24 hours anesthetist, pediatrician should be available, and the mother should be monitored continuously. If there is any scar pain or scar dehiscence, we have to take the baby immediately within 15 to 20 minutes to save the baby. There is 1% risk of uterine rupture. If 100 women go in for that, 1 woman may end up in uterine scar rupture, and that leads to morbidity and mortality in the baby. So
Thank
we
you
have
very
to
much.
discuss with the
Okay.
We have
Yes.
had lots of success stories with vaginal birth after cesarean section, as Dr. Siraj said, careful selection of the patients, and also we have the proper infrastructure and also the expertise to do that. And the risk of uterine rupture, as mentioned, is 1 in 200, and we carefully select patients, and most of the cases what we select and take for VBAC is going to be low risk cases, and the actual risk is going to be even low. So with proper monitoring of the baby as well as the mother intrapartum, I think we can decrease the risk. And we have had lots of happy mothers going back after a successful VBAC.
Thank you very much, doctor, for your thoughts on that. We move on to our next question that is a little lengthy, but I'll try to sum it up as much as I can. So there's someone who says that she's carrying for the first time, and in the kind of chaos in government hospitals, they don't allow husbands to enter the labor room. So what kind of support should she ask for, and can she demand government hospitals to allow their husband during the delivery? So any thoughts on that? Maybe
Yeah.
Dr. Anita, you can share thoughts. Yes.
Yes. Yes, because regarding the birth companion, it's not only the husband, but her mother or anyone close to her, a friend of her, anyone can be a birth attendant. So they can, if they want a birth companion or a birth attendant, can be very well arranged in government hospitals also. That will support her throughout the process of delivery, be it intrapartum and as well as postpartum. So birth companions are allowed to be during the mother through the labor process, because this enhances the confidence in her and the fear factor. Everything comes down with the presence of a birth companion. So it's allowed in government hospitals also and in private hospitals also.
Thank you very much, doctor, for your thoughts on that. Yes, Dr. Siraj.
some points to add. As Anita madam told, they are allowing in government hospitals, they are having some Lakshya programs. They have separate rooms and all, and birth companions, they are allowing only female attenders right now because of the space constraints, and we cannot allow the more crowd to come in. So right now they are allowing female companions with them in the GH also.
Oh, thank you very much, doctor, for your thoughts on that. Our next question is, in case of IVF or ICSI conception in 32 years with previous miscarriage, what would be the ideal delivery choice? Should we try a normal labor or C-section? Dr. Susan, if you have any thoughts on that.
Just because it is an IVF or an ICSI that is there is no contraindication, if at all it's your first one, to go ahead and go for a trial of labor. So preferably every primi gravida, that means the first time that you're a mother, should undergo a trial, because we never know which baby can go in for a normal delivery. So from my side, I would suggest going for a trial of labor. In case there is no progress, or in case the baby goes in for a distress, we can always plan ahead and go for a cesarean section. Now, if you do not want to go ahead such for a trial, and you feel that I would rather go directly for a section, for a cesarean section, you can plan along with your doctor for a elective cesarean section.
Thank you very much, doctor, for your thoughts on that. I think we have two more questions before we close it. Our next question goes, what is mastitis? If you can break that down for our audience. Anyone can
Mastitis is just basically swelling and redness of the breast. That means there might be some underlying infection which is there. So for that purpose, you may have to see the doctor, where you can prescribe some basic antibiotics to help you.
Thank you very much, doctor, for breaking that down for us. We'll move on to our next question. It goes, is a low-lying placenta will not lead to a normal delivery? Will a low-lying placenta not lead to a normal delivery? Yes or no? Any thoughts from any of you?
So if you have a low-lying placenta and it's diagnosed early, usually we come across such reports in the NT scan when you do the 11 to 13-week scan. So during that period, when you do that, we always tell the patient there is a high chance of placental migration, which we call it, that placenta may migrate to the upper segment. So only in a small percentage it stays down. That is, it is called placenta previa. It is still low lying. It's covering the os. In such cases, there is a chance of you going in for cesarean section, but that will be decided only at around 36 weeks after a confirmatory ultrasound.
Thank you very much, doctor, for your thoughts on that. So that will take up our last question. So let's end this on a very, optimistic and positive note. So I want to get like one tip or one advice from each of you for upcoming mothers or mothers who have just given their birth. So any advice for them to maintain their confidence and calm at all time? One thought from each of you. We'll start off with Dr. Siraj, maybe. Yes.
Yeah. Before as Matt told, preconception, before conceiving also, we have to know about the things, what we have to take, the supplements, the risk factors you have, your family history. Before pregnancy, go just consult a doctor, tell our risk factors and be prepared. That's very important. Preconception counseling is very important to reduce the risk factors to morbidity and mortality.
Absolutely, yes. So Dr. Anita, any thoughts from you?
So for the to-be moms, I would always say motherhood is such a joyous experience. But nowadays, people, they get the many information from the social media. As previously said, what an influencer says how to be the perfect mother and how to be the perfect mother to the newborn, right? So you should not go by those ideas, but always discuss your antenatal health care. You can discuss with your consultant what is best for you, what is the best antenatal care for you, and how you are going to go through the postpartum period also. So in a way, each pregnancy for each individual is different. You can never generalize that this has happened to that patient, so it is going to be the same for me. So each pregnancy is for the patient. Even for a patient with the first pregnancy, the second pregnancy might well be different from the first pregnancy. So for to be moms, they have to accept like how the pregnancy for her is going through, and enjoy the process, enjoy the motherhood, and the postpartum period will be a really happy one when we have a healthy mother and a baby and good bonding between them, and not with the so-called perfectionism. But you should always be aware of the health of the mother, and also how to take care of the baby in the postpartum period, because there are many working mothers now who strongly will need a support system to take care of the baby even when she is finishing her maternity leave and then transitioning to her work period, right? So that is very, very important. So other than the healthy antenatal checkups and the delivery, she has to prepare herself for the next phase, so that the transition between her motherhood and her as a working woman is a very smooth one.
Thank you very much, Doctor, for your thoughts. Dr. Tendril, any thoughts from your side?
Okay. As I said, the importance of preconceptional counseling. Though it is increasing, we see that it still has to increase. The awareness, we have people, the women who are here, they have to spread this word of preconceptional counseling, so that before marriage, before so much of money is spent on a marriage, at least some amount should be spent for a preconceptional counseling, doing the necessary tests, investigations to see whether you're fit for pregnancy. And these changes have to happen in the society. Only women like us can do it. And there are so many myths regarding pregnancy, breastfeeding, and so on. So for that also, we have to like be confident. Women have to be confident. Mothers have to be confident. Dispel all these myths. Talk to your experts, and then understand what it is. Make informed choices, and there you are. So you can enjoy parenthood, and we are there to handhold you throughout the pregnancy journey.
Absolutely. Totally agree with you on that, ma'am. And closing thoughts from Dr. Susan, anything you want to sum up the entire thing with?
I think we've got a very holistic response from all of them regarding what to be said, and all my seniors seem to have so many things compared to what I might have as such to offer. Breastfeeding, that's why I said every aspect of your pregnancy, right from, what should I say, preconception to your antenatal period to your postpartum period and your breastfeeding, your 1 year postpartum period also. It's a very, for it to be a very smooth sailing point, you require support. The support system which comes helps a long way. That helps in you coming in for the proper antenatal checkups, you coming in for your timely delivery where you might require to make decisions which are sudden. So your support system is what will drive you through your entire pregnancy. Having a good support system at home, even after the baby's delivery, is very, very, very important. So the one thing I would bring about is, without adequate support, be it from home or from your peers, no delivery, no pregnancy, no antenatal period is going to be easy. So yes, women have to brace themselves for what the little bit of a rough journey which might be there, but we're the only people who can adjust and know how to bring about things. So I think that's the reason why God created mothers, so that we have the ability to multitask. So anyway, I would suggest, other than for your support system, nothing much more required.
Absolutely. Thank you very much, Doctor, for sharing your closing thoughts. I think this was a super duper webinar where we all got a lot of insights on motherhood itself. So this was a webinar on understanding motherhood and postpartum care, presented by Kauvery Hospitals under the Hindu Wellness series. To all the to-be moms and the moms who are doing a great job already, here's wishing you all an advanced happy Mother's Day. Embrace the joy, and thank you so much for joining us. Thank you so much once again to all the panelists as well.
Happy Mother's Day.
Happy Mother's Day.
Thank you. Thanks for the opportunity. Happy Mother's Day.
For the opportunity. Happy Mother's Day to all.